I'm Julie. On this occasion I will talk about signs and symptoms of breast cancer. Anyone can develop this cancer, and it is still not clear what causes it. However, certain factors put you at a higher risk. Women who get annual mammography screenings are much less likely to die from breast cancer than those who do not. Although it is more common among women, men can also get breast cancer. Here are some important warning signs of breast cancer. 1. Lump in the breast or armpit. Feeling a lump in your breast or armpit may be the first warning sign of breast cancer. Such lumps are often hard and painless, though some may be painful. A lump under the armpit may feel hard or thick and dense as compared with the armpit on the other side. Do not panic when you notice a lump, as it is not always cancerous. A few common causes of breast lumps are hormonal changes in the body, a breast infection and fat necrosis, damaged tissue. It is important to have your doctor check out any new or suspicious lumps on your breasts to determine the cause. 2. Red or swollen breasts. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. When breasts hurt, most women think it is due to premenstrual syndrome, PMS, and when breasts feel hot or appear red, they usually suspect an infection. Swollen breasts with soreness or redness might even be a sign of breast cancer. A tumor located underneath the breast can push on tissues, making the breast swollen and sore. In some cases, the swelling is more prominent under the arm or under the collarbone. If you have this symptom for more than a week, be sure to see a doctor. 3. Nipple discharge. Discharge from your nipple without any squeezing or touching of the breast may make any women wonder. Other than breast milk, any kind of nipple discharge can be a warning sign of breast cancer. When a tumor starts in the milk ducts just under or around the nipple, it may cause irritation and infection, leading to discharge. If you notice any nipple discharge, particularly clear or bloody, get it checked by your doctor. Such discharge can also be due to an infection or other condition that needs treatment. 4. Pain in the breast or chest area. If you have an ache, sharp stab or pain in the breast or chest area, it is not a good sign. Sharp pain that comes and goes or a mild electric sensation that you may experience from one breast to another may be a sign of breast cancer. A tumor located directly behind the nipple or in one of the milk ducts often causes pain and discomfort in the breast. Though not necessarily a warning sign of cancer, pain in the breast or chest area can be due to other serious health issues that may need treatment. At times, breast pain can be due to hormonal changes in the body, birth control pills, poorly fitting bras and stress. 5. Changes in breast appearance. Any change in the shape or size of your breasts is a matter of concern. You also need to keep a close eye on dimpling, shrinkage and recent asymmetry of the breasts. Deep tissue growth in the breasts may affect their shape or size, leading to physical changes. As these changes are more about appearance than feel, you might become aware of such changes while looking at yourself in a mirror. 6. Nipples become sensitive. A change in nipple appearance or sensitivity can also be a warning sign of breast cancer. Often a breast tumor is located just beneath the nipple, which can lead to changes in the appearance and feel of the nipple. It might become inverted, flattened or indented, and there might be an increase in nipple sensitivity. A change in the feel or appearance of the skin on the nipple can also be due to mastitis or other reasons. It is best to discuss it with your doctor to rule out the possibility of cancer. 7. Itching on the breasts. An unknown cause of itchiness around your breasts can also be a sign of breast cancer, but this is very rare. It may be a sign of a type of cancer called inflammatory breast cancer. Due to the tumor, the skin above the area can become red, inflamed, painful and itchy. The itchiness is extreme and makes you feel like scratching the skin. No matter how much you scratch or apply ointments or lotion, nothing seems to relieve the itchiness. If you have a patch of itchy skin or you are not able to reduce the itchiness of your breast, see your doctor right away. 8. Pain in the upper back, shoulder and neck. When a tumor spreads to the spine, it causes unexplained pain in the upper back, shoulder and neck. People often confuse such pain with sore muscles, a pulled tendon or ligament, or osteoarthritis in the spine. If the pain is due to cancer, it will not go away with stretching the muscles or changing positions. If you are not able to reduce pain in your back, shoulder and neck through physical therapy, get it checked by your doctor. Hi, I'm Julie. On this occasion I will talk about warning signs of cervical cancer. 10 warning signs of cervical cancer you should not ignore. Cervical cancer is one of the most common cancers in women worldwide. It occurs in the cells of the cervix, the lower part of the uterus that connects to the vagina. The American Cancer Society estimates that about 12,900 new cases of cervical cancer will be diagnosed and about 4,100 women will die from this disease in 2015. These estimations are shocking but true. Almost all cases of cervical cancer are caused by a virus called human papillomavirus, HPV. Women of all ages are at risk of developing this cancer after they begin having sexual intercourse. Risk factors include unsafe sex, multiple sex partners, being overweight, use of oral contraceptives, genetics, smoking, poor immunity, multiple pregnancies and first pregnancy at a young age. One of the scariest things about this cancer is that it does not show any symptoms in its early stages. After the disease has spread through the bladder, liver, intestines or lungs, the symptoms are more prominent. Here are the top 10 warning signs of cervical cancer you should not ignore. 1. Abnormal vaginal bleeding. Most women diagnosed with cervical cancer experience irregular bleeding. An untimely bout of vaginal bleeding that occurs regularly could be an indicator of cervical cancer. It could also be due to other medical conditions, such as a hormonal imbalance, pelvic inflammatory disease or an infection in the pelvic organs. As cancer spreads to nearby tissues, it creates new, abnormal capillaries that break easily and cause bleeding. Such bleeding may happen between menstrual periods, after sexual intercourse, after menopause and even after a pelvic exam. Contact your doctor if you experience bleeding between menstrual cycles or following sexual intercourse. 2. Unusual vaginal discharge. Before we continue this video, do not forget to subscribe my channel to see other useful health videos. A little bit of clear, odorless vaginal discharge is normal. However, if vaginal discharge increases, smells foul or has an irregular appearance, it could be a sign of infection or cervical or endometrial cancer. When suffering from cervical cancer, vaginal discharge could be heavy, pale, watery, brown or mixed with blood. If you experience this symptom, report it to your doctor immediately. 3. Pain during intercourse. Painful intercourse is another important warning sign of cervical cancer. This symptom indicates advanced cervical cancer, which means the cancer has spread throughout tissues and reproductive organs. Apart from pain, you may also experience other symptoms, such as thick, foul-smelling vaginal discharge. There are other possible reasons for this particular problem, such as an infection or STD. Do not ignore the symptom. Get your cervix examined by your doctor. 4. Pelvic pain. Pelvic pain is common among women. Cramping and aches are a normal part of the menstrual cycle and do not usually indicate the presence of cancer or any other serious condition. However, pain that lasts for longer periods of time and occurs more frequently could be a sign of cervical cancer. If suffering from cervical cancer, you may experience pelvic pain at unusual times, and the pain may start suddenly at any time during the month. In addition, such pain usually does not occur unless the cancer is in a very advanced stage. If you have experienced pelvic pain or pressure, visit your doctor to find out the exact cause and rule out the possibility of cancer. 5. Discomfort while urinating. Cervical cancer can also cause discomfort during urination. In fact, it is one of the most obvious and prevalent symptoms of this deadly disease. Urinary discomforts include burning, stinging or a tight sensation while urinating. Such symptoms occur when the cancer has spread to nearby tissue. This requires immediate attention to prevent further damage. However, However, urinary discomforts also can be due to other causes, such as a urinary tract infection, bladder problem, yeast infection or sexually transmitted disease, STD. Get checked by your doctor for proper diagnosis and treatment.